This is the last video over Chapter 7. We're going to be looking at bone disorders. A stress fracture is a break caused by abnormal trauma, like for instance being in a car accident. A pathological fracture is a break in the bone that's been weakened by disease, such as cancer or osteoporosis. Fractures can be classified by being displaced versus non-displaced. Displaced means that the ends of the broken bone are out of place. So you actually have to manipulate it and put it back in alignment. Non-displaced means they're still aligned together. Open versus closed is the new terminology for simple and compound. Open means you have broken through the skin. Closed means you have not. When we look at these x-rays, this is a non-displaced. You can see that the bones are still lined up very nicely. This is displaced. This one is going to have to be manipulated and lined up again. Comminuted is where there is multiple breaks. Green stick is usually seen in children. This is where the bone is bent on one side and broken on the other. They have more collagen fibers. Their bones are a little bit more flexible. When we heal fractures, there's a certain process that occurs. The first thing is once you break the bone, you are going to form a hematoma. This is a blood clot. Once you have formed a hematoma, this is going to be converted to a soft callus. This is fibrocartilage. You will have lots of collagen fibers in this. That soft callus is then going to be converted to a hard callus, which is spongy bone. That spongy bone will then slowly be remodeled and you get compact bone. A closed reduction, this is where you have a procedure in which the bone fragments are manipulated into their normal position without surgery. Open, this is where you need surgery, usually plates, screws, pins. A cast, of course, is used to stabilize and immobilize that bone until it heals. Here is looking at an open reduction on an ankle fracture. You can see the plates and the screws on this. Osteoporosis is the most common bone disease. It affects mostly spongy bone. The areas are going to be mostly the hip, the wrist, and the vertebral column. In the vertebral column, you see that the spongy bone inside the vertebra collapses. There's not enough calcium. It is very weak. And so this can start to deform your spine. You can develop kyphosis, which is an exaggerated thoracic curve to your spine. Some of the complications that can occur with this is pneumonia and thrombosis. Estrogen helps maintain your bone density in both sexes. What it does, it inhibits those osteoclasts. So who is at the greatest risk is going to be postmenopausal white women. We do see osteoporosis in young female athletes that have a very low body fat. That low body fat causes them to stop ovulating, and that decreases their estrogen blood levels. There are a number of treatments. One is estrogen replacement therapy. We have medications that destroy osteoclasts, but the best treatment is prevention. So while you are young, exercise and build up your skeleton. And so this prevents bone loss later on in life. If we look at some figures here, on the left-hand side is spongy bone that is nice and healthy. You got good calcium in here. On the right side is osteoporosis. You have lost calcium, you have lost trabeculae. This is very likely to collapse. If we look at this image, you can see this vertebra has collapsed down because of the weak spongy bone inside. This is the end of chapter 7. The next chapter is the skeletal system.